My name is Patricia Carrington, and I am the supervisor of the Multisystemic Therapy and Multisystemic Therapy for Problem Sexual Behavior program at Family Services of NWPA. Family Services is a private, nonprofit, fully accredited social service agency with services for families and individuals in Erie, Crawford, Mercer, Venango, and McKean counties in Pennsylvania. Our mission is to strengthen families and transform lives. Service divisions at Family Services include child welfare services, in-home behavioral health services, school-based services, mentoring and education services, and an outpatient psychiatric clinic. The Multisystemic Therapy program is part of the In-Home Behavioral Health Services Division. Family Services is accredited by Council on Accreditation, which provides assurance that our services meet best practice standards nationally. Family Services has offices in Erie, Crawford, and Mercer counties. The hours of operation at all main locations are Monday through Friday from 8:30 to 4:30 p.m. and evenings by appointment. We have 2 offices in Erie County, including our main office at 5100 Peach Street and our metro office in downtown Erie. Multisystemic therapy is offered in Erie, Crawford, and Mercer counties and has offices in all 3 locations. Services are conducted in the family's home. Satellite offices are located at Pfeiffer Burley Elementary School, McKinley Elementary School, Union City Elementary School, and Union City Junior Senior High School. Services at satellite offices are provided by appointment only. To learn more about our services available at any of our locations, call 814-866-4500. You can also visit our website at www.fsnwpa.org. Multisystemic therapy, or MST, is an evidence-based program that helps youth decrease and prevent antisocial and delinquent behaviors. We serve adolescents between the ages of 12 and 17 years old and their families. Multisystemic therapy for problem sexual behaviors, or MST-PSB, is an evidence-based program that helps youth exhibiting sexually related antisocial or delinquent behaviors. Many are involved with the juvenile justice system due to problem sexual behaviors. MST-PSB primarily services youth and young adults between the ages of 10 and 17 and a half. Other ages are considered on a case-by-case basis. For those youth whose primary presenting issue is problem sexual behavior, MST-PSB is the appropriate treatment. Youth in both MST and MST-PSB are at risk for out-of-home placement or returning home after placement. Referral behaviors can include truancy, curfew violations, substance use, lack of school success, delinquent or unlawful behavior, and family conflict. To qualify, there must be an identified need for intensive clinical in-home services. Referred youth must also have a home and a caregiver who is available to provide support and involvement in treatment. Referrals to MST and MST-PSB are typically made by other service providers and agencies on behalf of the youth and their family. We cannot serve youth who are living independently or who do not have an identified primary caregiver, youth who are actively suicidal, homicidal, or psychotic, and youth whose psychiatric problems are the primary reason for referral are also unable to receive services. MST and MST-PSB at Family Services are evidence-based programs that utilize intensive in-home therapy. Therapists work primarily with the parent or identified caregivers to determine when it is appropriate to involve the client and other supports. Emphasis is based on safety and child well-being through individualized safety plans. We also address every system in the adolescent's life. The MST-PSB program at Family Services is a clinical adaptation of MST that has been designed and developed to treat youth and their families for problematic sexual behavior. It focuses on the wide range of individual, family, peer, and academic problems that are commonly associated with juvenile sexual offending and other problem sexual behaviors. Since most of the families we serve are multi-problem families, MST offers parenting skills development, problem solving, and common areas of parental management. This includes handling of childhood behaviors, tendencies toward the inappropriate expression of anger, and related conduct-oriented difficulties. MST therapists use a variety of techniques to assist the family, including contracting homework, behavior modification and management, communication, cognitive skills, and structural therapy. Treatment commonly combines intensive family therapy, parent training, cognitive behavioral therapy, skill building, school and other community systems interventions, and clarification work. The goal of MST and MST-PSB is to prevent unnecessary placement of children and/or reduce the length of placement by strengthening the adaptive capabilities of family. A goal of treatment is for families to manage their family unit effectively rather than relying on outside services. Specific treatment goals are individualized to each family and tied to behavioral health needs. Referrals to MST and MST-PSB at Family Services can be made by other social service agencies, doctors' offices, and hospitals. We also accept self-referrals. The Office of Children and Youth and Juvenile Probation Offices can make direct referrals from families who do not have medical assistance and/or do not meet the medical assistance or managed care diagnostic criteria, but meet all other MST inclusionary criteria. To begin the process, a referral form must be completed to determine program eligibility. To learn more about multisystemic therapy at Family Services, please call 814-866-4500 or visit www.fsnwpa.org.